CNS anomalies or central nervous system anomalies and how to diagnose them prenatally by ultrasound. At first, we should think of the brain anomalies or the spine anomalies. The brain anomalies can be cystic lesions inside the brain, can be anencephaly or anencephaly, or acrania or exencephaly, can be extracranial cysts, to find some extracranial cysts, and the most common differential diagnosis for these are the cystic hygroma, encephalocele, and cranial meningocele. Acephaly or acephaly, which is completely different from the anencephaly, there is no head. In anencephaly, there is no part of the vault of the skull, and so there is a frog face appearance, but acephaly, there is no head. And that's common with the twin reversed arterial perfusion syndrome, which is occurring in twins. And brain tumors. Brain tumors are extremely rare in the fetus, and so of course, when you find tumors can be diagnosed easily, but not among the common congenital anomalies. Cystic lesions of the brain, and unfortunately, many of you, when I publish a picture for the cystic lesions of the brain, you comment as hydrocephalus or hydrocephalus, and some are saying holoprosencephaly, and some say hydranencephaly. It's very important to know the differences between these variants and these anomalies. Hydrocephalus, hydranencephaly, or hydrocephalus or hydranencephaly, holoprosencephaly are completely different entities. Cerebellar cyst in the posterior compartment. The differential diagnosis can be Dandy-Walker malformation, Joubert syndrome, Mickel-Gruber syndrome, and of course every one of them have different associations with the presence of the cerebellar cyst. Aneurysm of vein of Galen and arachnoid cyst are in the midline. And so when you find a cyst in the midline of the brain, which is at the falx cerebri, you think of the aneurysm of vein of Galen or the arachnoid cyst, and simply you introduce Doppler ultrasound. The aneurysm of vein of Galen is giving color. Arachnoid cyst, no, will not give you that color. Interhemispheric cyst. So all these are at the midline, at the falx cerebri. Schizencephaly is completely different, or porencephaly is completely different from all the other entities. I call it as a brain bite. As for myself, I'm considering it as something biting, brain bite, which is not respecting. I always say that it's not respecting the midline. Choroid plexus cyst, of course, at the choroid plexus. So these different entities should at first you should know by heart the compartments of the brain. And so we can easily find the differences between these lesions and different lesions of the brain. As I told you, cystic lesions of the brain or the other entities. I'll give you the pictures by ultrasound, and I'm waiting for your comments on the pictures.